Dr. Pons, for taking the time to speak with us. We have partnered with the NAACP to sponsor this conversation with Dr. Pons, our, as you know, Superintendent of the Montclair Public Schools. I am Education Chair, Board of Directors with the League of Women Voters of the Montclair area. Dr. Pons will address the concerns and increasing challenges we recognize exist for educational communities. The stage has been set for everyone. It's what I've coined the pandemic's platform. COVID-19 is dictating the standards, time, creativity, initiatives, and budget by which we must abide. As humans, we know our physical reactions, emotions, sensitivities, experiences, and feelings are all intertwined. We understand that developmental stages in children and adults involuntarily influence behaviors. How do we blend all of these variables for Montclair's families as we move forward? What's the plan? Do we have stages? Is it evolving? Is it transparent? In the essence of time, we asked our community to submit questions in advance. Thank you for your interest and submissions. The questions were given to Dr. Pons. So now let's ask the questions and get some answers. Dr. Pons, welcome again, and thank you so much for sharing your time. Would you take a few minutes to share highlights of your professional career and your key achievements?
Absolutely. I am highlights in my career is I was blessed when a friend of mine spoke to me and said, Jonathan, you'd be a great teacher. And we played basketball together, and we were sitting really in a restaurant. We were talking, and he's an educator before. He says, you'd be a great teacher. I said, you know what? He says, I'll give it a shot. And the highlight was one of my life was doing that. I ended up taking a position as a teacher in Boston for at-risk kids and special needs. And these kids were children who went through a lot of things in their life. And I learned how much I enjoyed education by working with these youths. And it was more than just a show up and walk out job. You had to be a counselor, you had to be a pseudo parent. They asked you all kinds of questions about life. And so I loved it. And the next thing that happened to me, I was asked to be the basketball coach in the same school. And I love basketball. I love basketball. So I did. And me, the kids there, we had good seasons, but it was really about being there for the students and being that figure. And we had a policy. You had to behave and if you're going to be on the basketball team. You had to do your homework and do your grades. And then my times off, my prep times, I would walk around the building to make sure the athletes and the students were doing the right thing. And then we had a situation where you had to not only be academically sound, but on away games, I used to give ties to students, get to wear a tie to away games. Okay. And we did it purposely just to say, you matter and who you are means something. And we became that team that traveled on our little bus and got off that had a certain look. And when you win, you have that look, it's great. And I remember, having a team in Dorchester, which can be a tough area, doing those things. And it meant a lot to me. And from there, colleagues and supervisors said, you should become a principal. So I got rid of my green truck and ended up going to school at night, getting my master's degree. And then I was blessed to get my doctorate degree while I was working. And I had a chance, Sidney Smith, I'll never forget him. He's still kind of a mentor of mine. And he gave me a chance to be a principal of a district that was struggling. And we were able to turn the district around, but I learned then how to lead. And it was about being a person and let them see who you are first and foremost. And I learned through doing that and leaving my office. And I remember this funny thing, I had this beautiful chair was given to me on my first principalship. It was a beautiful leather chair. I put it in the office, and the first day Sid saw that chair, he goes, Jonathan, that's a beautiful chair. You're never going to be sitting in it. And I figured out later what he meant, that I was always out and about. I was always walking around. I was never in the chair. The chair is now downstairs in my kids' room, and they play with it and they use it. I haven't used it since then. But it meant a lot to me, and it taught me how to lead. And when you lead, you have to see who you are as a person. And then I met my wife. My wife asked me what I was teaching, and she wanted to move to New Jersey, and the two kids in my life, my three sons, were big parts of this. They mean so much to me, and so my wife wanted to be closer to her family, so we did. And I was blessed enough to get hired in North Brunswick, and then my first superintendency in Moonachie. I was on the phone recently, coming home, talking to the young man who replaced me there, and he was also someone who worked with me there. And Moonachie was the first place where I really just saw a community just really decide that we're going to come together and we're going to move our district and our town. And I was so blessed to be a part of it, and so blessed to be able to be the leader there during this time. And we just locked arms. And I remember I would go to the senior center, and they had these wonderful luncheons. And the city councilman, Mr. Saracello, he actually also made these wonderful motts. And I got a chance, he would never let me leave without eating them. And Mr. Palace, Mr. Palace is a board member still there, and he's almost 100 years old. I think he's 96 or 97. Mr. Palace had the toughest questions for me every time, but I used to enjoy sitting with him and listening to some of the things he would do. He was a former chief auditor for the state of New York. Talk about some of the things he would do. It was wonderful. But when we were able to see the movement in that school district, it was great. And I was able to be a part of it and witness it. And it was just, I was thankful for it. Just thankful for it. And those are some of the highlights. Now the highlight is in Montclair and leading during these challenging times. We're in a pandemic, and every once in a while we're reminded by the pandemic. When you hear about a person, a staff member coming down with COVID, or you hear about just situations where you worry about kids not getting what they need during this time in virtual world. Those remind me of how humbling leadership can be, and how humble you have to be a leader. So that was a quick version of my highlights and me as a leader.
Thank you so much. Now, when you came to Montclair, I'm sure you set some goals and objectives as of July 1st. Will you provide us with an overview of what your goals were July 1st, 2020?
Yes. So I did a lot of research before I came to Montclair, and I wanted to know what was great about Montclair and what the history and the legacy Montclair has, which is tremendous. And I also wanted to know, like, how could I benefit? What benefit could I be a leader? Is it a good match for me? Can I lead? Do I have what Montclair's looking for? Do I have what they need as a leader? And so a couple of things that really excited me that went into the goals that we have for the district, the board goals and the district goals, about one, knowing that diversity matters and that we're better together and working together. So I always say diversity is our strength. And it is, and Montclair is extremely diverse, and that's a strength. And how do we manage that strength? And one of the goals of managing it is being culturally responsive, talking with each other about our differences and celebrating those differences with each other was one of the things was one of our goals we have. So training our staff members, our administrators on being responsive to each other culturally. The other thing is reading. I really enjoy reading. I enjoy teaching reading. I enjoy being a leader of educators who teach reading. I teach everything, but reading is one of the things I love. And so when I saw that we had disproportionate group of students not doing well academically, and saw reading was one of those parts, I said, whoa, I have a skill set for that. And that became one of our goals, making sure that all kids read at or above grade level. And one of the things I also saw became one of our goals is that we noticed that not every child was excelling academically. We said to ourselves, we need to make sure every child does. So even the child who's doing well, we want them to do better. The child who's not doing well, the child who's not getting those grades, getting put in different categories because they have a dyslexia problem, those things. We felt that, I felt that, hey, that's a goal for us that we need to do to improve educationally for our kids. And the other thing is, I did hear, and I just saw that comment come up, we do live in an environment right now that's divided. And I feel that part of what I want to bring is us together around these pieces and working with that, and how we do that. And I was talking with one of our student leaders about practices such as like reciprocal teaching and Socratic seminar. We're able to talk and have norms about how we talk about books and literature and those things. That can bridge those divides. And the other goals that we have, we really felt that our special education pieces, that we need to improve upon that. And I'll give you a quick story. So I was getting emails around class rank, and I wanted to know, like, why is class rank an issue right now? Why is it a problem? And then when I started delving into the issue more, we found out that some kids weren't being able to take some classes because they had an IEP. So it threw me back. I was a little thrown back by it. And so we felt that, wow, we need to really look at how we're working with our students with IEPs. Because you have an IEP doesn't mean you can't do well. It means you need some accommodations here or there. And so it threw me back. And so what I said, okay, that's part of one of our goals. Is one of our goals. So of how we're going to move things forward, working with making sure our special education department, make sure our resources for our special education students are sufficient for us to move forward. And then restorative justice. Restorative justice has a lot of research around it, around how you can bridge groups together, how you can have conversations rather than having such a punitive reaction to things. How do you have students who may have a disagreement? How do you have them discuss that and reach like a mutual understanding of each other and solve a problem rather than having a punitive side to it only? So those are quick version of our 5 goals that are out there. And those goals have other pieces to them. You know, for instance, when we talk about dyslexia, we're working right now with Fairleigh Dickinson University on Orton Gillingham, which is a research-based training on helping students with dyslexia and reading. So we're doing those pieces. So these pieces get bigger. Restorative justice is something we're doing and training across our district. We have 3 new schools that are going through this restorative justice initiative right now, and we're training staff members and administrators on this piece also. We look at disproportionality with special education. We are looking to do an assessment of our special education with an outside consultant recruiting from Seton Hall. They'll give us definite 3 goals we can really dig into that's going to help us improve our services for our special needs students. So these goals have other pieces to them, and we're excited about getting engaged and getting those pieces done. And in a difficult time, because right now we're trying to do this while we're in the middle of a pandemic. But that's still no excuse for us not moving forward and getting these initiatives met. So I hope I answered your question.
Thank you for your response. Now, looking to the future, let's say December 1st, 2020, how would you evaluate your progress toward these goals and objectives?
Well, that's a great question. So I'd like to first start by saying we're doing the assessment. One, I'm listening to people and asking people questions. They're telling me some great information, such as the class rank. The next thing is that we're looking at doing assessing like Orton Gillingham and with Fairleigh Dickinson. That program's up and running right now. We've recruited, I believe, 12 teachers to start out with. We're using our monies through our Title I's monies for this. And so then we have, not Title I money, but our monies from the state that goes to disproportionality we're using for Orton Gillingham. And we're planning on bringing on more teachers. So we judge it right now because we don't have some tangible data around assessments when it comes to student achievement. We're judging it right now on our progress on what we're doing, and we're doing it with fidelity, consistency. Another way we look at what we're doing is that we're looking at, for instance, when we made an adjustment on class rank, we made that adjustment based on information we had around students not getting into classes they should have gotten into. We look at reading. We were meeting with principals just yesterday about response to intervention in IRNS, and I had a principal actually email me tonight about this, and she gave me her update of what she's doing in her school, so we can actually consolidate what we're doing across the district around these pieces. We're working currently, our Assistant Superintendent of Equity, Curriculum and Instruction is working mightily with our restorative justice team on the plan moving forward. But also we had a PD on our day off on October 12th with our staff members on restorative justice. Those three schools we are bringing on, I believe it's Bradford, Bradford, Edgemont, and I can't think of the other school right now. But we did those. So when I look at assessment right now, our activities, how are activities that we're doing meeting our goals or pushing us closer to our goals?
Okay. That's a challenge since
It-
we're working virtually.
yes, ma'am.
Um, how are your plans? What are your plans, I should say, to eliminate the achievement gap while learning virtually?
Wow, that's a great question. And I would like to talk about how we are, we're doing a lot of things to do this. One, I can't say thank you enough to Mr. Pellerman in MNDC, places like Amani, sister to sister, brother to brother, those tutoring agencies that are working with us and helping students. We're going to continue to support them. But we're also going to try to increase them because right now in a pandemic, the digital divide that we've had to face is making it more difficult for students to get there. One of the things we made a commitment to this summer going into the digital divide was saying that we're going to make sure that we give every child what they need when it comes to technology, and they won't have to pay for it. So we've had to go out and purchase quite a few laptops and hotspots. And these hotspots are things like this on your computer to make sure you have internet connectivity where you are. And so we've done that to bridge the digital divide. But even when we do that, we have to work with our tutoring programs and to make sure that works. And we had a wonderful discussion yesterday with our principals around what are we doing for interventions and how are we looking for best practices around instruction during this time. And one of the questions that I'm so proud of our principals, one of the questions that we had was, what are our best practices right now with our best teachers during this time?
Yes.
How are we gonna get those best practices that our teachers are doing during this time? They're working across our schools. So we're really digging into that because it's critical. It's critical. And I was talking earlier, as a former teacher, the social pieces you have with your students in your room are a big piece because they learn from everything you do.
Yes.
And having it in this medium is very difficult because it's hard when the student asks you a question that, hey, Dr. Pons, or back then Mr. Pons, how would you solve this problem? You used to go there and, you have the pencil, you do the problem for them, a part of it, and they would do the other piece for you, and then you would just help bridge it that way. Now we can't do that, and that makes it very difficult. And you can put it on a board, you can put it on this, but it makes it very, very difficult. And that's some of the pieces we're trying to get through. I was talking to my former colleague, and you can do some one-to-one tutoring on the computer screen, but that means you have to have a certain set of sub skills. And for our younger children, they don't have those sub skills sometimes. So that makes it very, very hard. So I personally, feel just the need to have to get those things met during this virtual time. And so my anxiety goes around those students and those things that I know as an educator that needs to happen. And I didn't anticipate the pandemic being this long.
Right.
I really didn't. When I first heard about this, as a superintendent at Montclair, they said 2 weeks. So we planned for 2 weeks. That 2 week turned into 3 months. Then it turned into the rest of the school year. Then now it's turned into, my goodness, in the January, and we're looking into the spring and into the school year. And I'm hoping we have a normalcy back next September. But that means you have to make decisions with the information you have at that moment. It's like crisis intervention. It's like crisis leadership 101. The information changes. And so when that changes to you, you have to make that decision sometimes at the moment. Like, wow, I didn't know that the infection rate was getting this high, or I knew it was, but now it's really getting to a point where we're worried about it. And those things create different dynamics. But through all that, we still have to educate our kids. So this is a test of my leadership. And I'm going to pass this test because I have to pass this test for the kids of Montclair, the families of Montclair. But hope I answered that question, but I have a tendency to ramble on sometimes. So please stop me, and I can go on and on and on. My friend told me I can talk a dog off a milk bone. So
Okay.
please just know that about me.
I'll curtail you if need be. Thank you.
Yes, ma'am.
What about the students who require special services such as OT and speech? How are you addressing their needs?
We're
during
not doing it well. We're just not doing it well. We can't do it virtually. And we've had to go out and look for outside agencies to try to help us on these things. And Mr. Santagato and I are having those discussions, and we got to get creative. This is lasting a lot longer than we anticipated. We have to get very creative. We went to go visit a 766 school in Bergen County. I was on the board of that school at one point. And so we're really, it's not working well. And there's a group of special needs students that need us to do things. So we've got to get creative about this piece. And he and I have just gone over and over again on this piece. There are students out there who could be regressing, and we have to get their needs met. And so we got to do it creatively. And so I go back to, an IEP says this, but the IEP is something that's interesting, but it's all supposed to be based on meeting a kid's need or meeting a child's need. And if it's not meeting a child's need in this current pandemic, the IEP is, and we have to change what we have to do. So I was anticipating us being able to do something more by this time.
Yes.
Since we can't, we have to change our path, take the information we have and make a different decision. So we're going to be making different decisions. We're going to be calling up families and making different decisions around how we're going to get the kids the help they need.
How are students being evaluated, tested, and graded?
Well, that's a great question. So we've been having that debate. How can we accurately do this?
Mhm.
Because it's a different medium.
Yes.
And so we're trying to figure out how we do that. And, is it fair? I heard a rumor that some people are getting help. They shouldn't get help to get better grades.
Mhm.
But at the same time, should we punish? Is it fair? So leaders right now, central office leaders, principals, we're all having a debate about what is fair, what's a fair assessment. We have to assess kids because these goes on transcripts that then go into schools. For instance, if you're high school and you want to go to college, you have a transcript you have to bring across. And so we have to do this well. And we're having a debate right now. How do we do it well? How do we make sure we're grading fairly? And it will come down to us having good faith in the fact that we believe a person is going to be doing their schoolwork and saying they're going to be their individual work. And we're going to have to trust them on that. And at this time, we're so far apart, we have to have some good faith and goodwill around someone's telling us this is supposed to happen, and it is happening. So some students saying, I'm doing this test myself, we're going to trust you on that you're doing the test yourself. And the grade will be your grade. But I always say, if you're not doing it yourself and you pass it, there's going to be a time you have to show the academic skill you say you have. I had a professor, when I was getting my doctorate, I'll never forget Dr. Gable. He goes, and we had this, it was a stats 2 class, and it was very hard, and some people didn't do well on it. And he always tell us, when I pass you, this means that you're able to do this in your life.
Yes.
And if you can't do this in your life, I can't pass you. So if we're gonna give you the test, you're gonna take it. We're gonna trust that you're taking it and you're being honest with us, because when you pass it, we're gonna certify that you can do this work, and you're gonna have to do it one day in your life, in the near future, particularly if you're going to college. And so we want to make sure that, that we're trusting that person and saying in good faith, you've done this work. So I hope that answered your question around assessments, but it's very, very difficult in this pandemic time.
Will the children get report cards?
We're thinking, I believe they're going to be getting grades. And Dr. Morgan's helping with this piece, the Assistant Superintendent of Equity, Curriculum, and Instruction. I believe they are beginning grades. They'll be getting something very similar to a report card beyond our Genesis system.
Okay.
They'll be getting assessed, and we're going to have that good faith that what they say is what they're doing, and they can provide it.
I see. Okay, thank you. How are the advanced learners being challenged?
That's a great question. And I've been told not to say great. It's a great question over and over again. So I'm going to try to pull back and answer this. A great question. So the SAIL program is led by Mr. Sedita, and he's pushed that program out even in this pandemic time. There will be helping kids who are high achievers through this program, particularly K through 8. We can make sure they're not losing out. And I know he's doing that program. I saw his email today. So the SEL program is for our higher achievers K to 8. I know our AP courses are still going on in the high school, and our advanced math courses are still going on. We know there's some students in the middle school who are trying to take classes like geometry and algebra so they can go into advanced classes in the high school. And we're still providing those online, but still providing those.
Mhm. Okay, thank you. Let's think about the pre-K. Do you have plans to bring the pre-K back to schools?
Yes, we want to bring the pre-K back to schools and our elementary students back to schools, and our and eventually our middle and high school. It's really predicated on the virus and what the virus dictates. And I would love to December 1st, I'm going to be reevaluating, giving a date. So I've talked to some of my colleagues who have dates in January. I want to make sure, though, when I give a date that we can really stick to it. But this virus really dictates it. The virus dictates what we can do. And it's just really about that in science. But December 1st, I made a promise to our public. I'm going to give us a date. I'm going to talk to my colleagues like I've been talking to my colleagues. Some have already set dates. Talk with them. How did you set the date? Why did you set that date? Talk to our medical team. Look at the data, compare the trend lines, and then make a date and then get our kids in. We really want to get our elementary kids in, our special needs kids in first and foremost. They're missing out the most right now, I believe, especially from the feedback I'm getting. Get them in, get them the assistance they need, make sure they can get them in safe, and make sure if we ask staff to come in, it's a safe environment for the staff to come in also.
Okay, thank you. Let's think about racism. Is there evidence of racism continuing in the Montclair Public Schools? Are students experiencing racial trauma? If yes, how are you solving these problems?
So back in May, the article came out that I read. The students did a march, and they talked about some incidents that happened in school. And my wife and I read it, and we discussed it. And it was difficult to hear some of the things happen. There's something online called Black in Montclair also that's out there. And we have some very strong student advocates who are now also working with the board and who are on our committees moving things forward. And they had 5 initiatives. I think we're 4 in place. We're working on 4 in place and looking at how we're going to adjust 5. So to say that racism does exist, be honest. How we're alleviating it, how we're working on it is one of our goals, cultural responsiveness. Mm-hmm. Working with staff members on how to be culturally responsive for all of us, every staff member from central office on down, how to be culturally responsive, how to identify microaggressions, and then how to alleviate those things when they happen. Well, also one of the things we're looking at and addressing through race yes. is hiring staffs that look like our students, mm-hmm. hiring staff across the board that look like our students, and then maintaining those staff members that look like our students. The stereotypes are a real threat. One of the most powerful things, though, that's happened for me in these last 5 months is being involved with our student advocate that's now the student representative on our board, mm-hmm. having them involved in our anti-racism policy that we've passed. That I got to just give a shout out to our board members who really pushed me to get this policy done in the first few months, my first 2 months here. Board members were adamant about it. And now as we write those regulations, our student advocates helping us write those regulations around the policy that we passed. Okay. Talking with teachers, teacher leader groups out there who came to us within the first couple of months we were at school and says, hey, we have a problem we want to help address. And working with those students about how this is going to work and listening to them and then getting some things through already. Our calendar changes, for instance, came from teacher leader groups that brought this to us and say, hey, this is real to us. And so, it became pertinent. But racism, to say it doesn't exist would just not be true. To say we need to manage it and handle it is absolutely true. But when I was interviewing this one young man, I can't think of his last name right now, Stephen, he was runner-up for the high school job. He said something during this interview process that really startled me. I asked them, I said, my mantra is all kids can learn, all kids are special. How are we going to do this? How are you going to do this to motivate your staff if you're lucky enough to get the job? And Mr. Freeman also did a wonderful job. He's our high school principal. The young man said, partly it's who you hire. You have to hire people who believe in all kids, that all kids can learn, all kids are special. So I talked to our HR director, Mr. Cooper, and we're adamant about that. We have to hire people that believe in every child that walks in our buildings. Every child, regardless of their race, regardless if they have an IEP or not, regardless of anything, every child that walks in our building, you have to hire them and say, and I'll quote Sydney Smith, my mentor, you have to care about those children like they're your own when they walk in the district. You have to work with them like they're your own, regardless of who they are and their backgrounds. So that's our challenge, hiring people who believe this and who do it day in and day out, who do the extra mile for the child, who believes in that child, regardless of their background, whether they're wealthy, or whether they're not, or they're middle class, working middle class. Regardless, do you care about this individual, this child in your room? Do you see value in them? Can you work with them to move things forward?
Okay, thank you. Another quick question. Looking at the high school, are students required to take classes that reinforce an understanding of our government structure?
We do have houses that do this, but I believe, particularly in our country, to have a democracy that's working, you must have an educated populace about how our democracy works and what you're right and what you should be doing in that democracy. I grew up in a place where, my aunt went to jail for the right to vote. And so I grew up in a place where this is serious and that you take it seriously, but you understand people. And so to understand people, you have to be willing to learn about our government, learn about what it means to be in a democracy, and your responsibility as a citizen in a democracy. Your responsibility is to be learned. And my wife and I, when we vote, we make sure we understand everyone's perspective in what they're going to do as a person. And we may not agree all the time on this individual, but we're able to talk about that with each other and move forward. And if you can't talk about these things, then you can't move forward. The one thing I learned when I was in civics classes is how meaningful local government really is, and how to get involved in understanding that you just don't vote for the president. You vote also for other local officials, and you also vote for congressmen and senators, and how important that is. I myself I do not see myself ever running for office. However, I think it's important for us to educate our kids on that. And I know we spoke earlier about this, but I am excited about having our new high school principal work with the Women Leagues of Voters and making sure our children, all of our children, particularly our high school kids, become thoughtful citizens in democracy, to vote, and to educate them on the process.
Okay. Now, do you see the pandemic as a chance to strengthen civics education and community involvement by doing things for the greater good, like wearing masks, avoiding crowds, being poll worker volunteers, obviously following strict safety measures? What do you think about that? It's a different way of thinking.
It really is. If you want to, I learned a long time ago, if you want to forget about your problems, serve someone else. And when you serve someone else, you'll realize, one, how lucky you are, but also your value, what you can do for society.
Yes.
And, some countries have you volunteer your time and have you volunteer your time as an adult or a child and give service. I don't think it's a bad thing. I believe in service. I think we have an opportunity in our country to grow from this pandemic. One, first and foremost, we see a divide even more so now than ever. More than ever, you see a divide between the have and the have-nots. So it's time, really, for us to take that opportunity. Me personally, as an educator, I'm going to use this medium somehow to improve how we're able to get to kids and educate kids. But also, this is a time for us to and one of our board members says this, Miss Robinson, this is time, and she challenges me, this is a time for us to reimagine things. And one of the things is reimagine education. How can we enhance education, improve education through this? One of the things we bring into the board is this is a time for us now for every child in our district to have a computer. And we're going to be looking at a one-to-one initiative in our moving forward. This pandemic brought that very clear to us. There were some children at home that didn't have internet connectivity, did not have a computer. So that's something that's reimagining, and we're going to reimagine things here in Montclair. The other thing is that when a child comes home, it's difficult. And a lot of things happen from 3 to 6 p.m. that can be detrimental to a child.
Mhm.
What about extending our school day? There's a grant out there called 21st Century Grant. Why not finding the right school and the right teachers that want to get involved in this and making this a reality for some of our schools in Montclair? That's something we're going to do. I'm going to say, hey, we thought about doing this. I'm going to bring it and do it from the ground up. I was speaking with a senior teacher, and that person reminded me of these things. So this is a chance for us to really reach out to each other. And one of the things we can do is, I'll say this, and someone taught me this before, actually yesterday when I was talking about conversations and how to have better conversations. Seek first to understand, and then to move forward. So I'm going to do this as an educator leader. Seek first to understand. I'm going to ask us to seek first to understand each other, and then to move forward. So, how does this child that lives on this street live? How does that impact how we educate that child, how we work with this child? How does this educator here perception of education? How do we work with what they've had in their lives that impact them? And I think about my perspective and my background in education impacts how I lead. Having to work in places where some kids not have everything, or having to kind of to be a teacher, to be a building administrator, to be a coach, that impacts how I also lead. And those things are my background, but now I have to find out someone else's background, like Dr. Morgan. Dr. Morgan, we talk all the time. Dr. Morgan, tell me about your background. And, she was a high school principal, and I was never a high school principal. I was the elementary school principal, middle school principal. So her perspective on things as a high school principal, this is a simple example, can change some things, how I look at some certain things, about how a high school runs, or how a problem in a high school may be different than a problem in elementary school, and how you work differently with things like SROs and those things to help kids. So I hope that was an example of how we can do things differently and move forward. But I think first we got to seek to understand each other and our perspectives, and then see how this pandemic impact us, and then move forward on that.
Okay, thank you. Now, thinking about the employees, do they have a reservoir of counseling resources that they can go to?
So I have put that question to our HR department because I want to make sure I had a good answer to it and I understood it. And they do. However, there's never enough resources for individuals. There is a thing you can go to with the HR department that can get you help, but there's never enough of it, particularly now, because now we're in a pandemic and you're more isolated. So you're asking someone who could be isolated, who may be in a building at one point, a colleague can help them with this phone call. You have to ask now, make this phone call by yourself, which can even be harder.
Yes.
So, that social piece we talked about earlier, when you're a colleague sitting next to you in a cafeteria or a lunchroom, and they see you're down or see you're struggling, you can give them a push and do something. When they're by themselves in their houses, it's different. And that makes it more difficult. So there's never enough supports. And I know our nurses have done a great job of giving family members calls. There's never enough support for educators out there. And quite frankly, educators are dealing also with COVID in their families and other places too. So there's a lot of mental things that are going on. And you never know when you're in the weeds. I had a great conversation last night with a teacher, and it helped me get out of the weeds, because I was in the weeds. I was in the weeds of this, that statement, this statement, and it kind of regrounded me. So it's always needed, particularly now in this day and age.
Does Montclair Public Schools offer counseling support to students?
Yes, we do.
Which may include parents as well, for coping with uncomfortable emotions that may surface, loneliness, grief, etc. Yes.
We can do more. We absolutely do, we can do more. We do, and I know there's initiative even around students hurting themselves in high school. They're bringing in a new group. Mr. Bear was in charge of that, and we're going to miss him dearly when he moves on. But we can always do more in this time. And even for families and parents, because they're now going through a lot of the struggles too, a lot of anxiety
Yes.
around this pandemic. So we do, but we can absolutely do more. And we need and have to do more, because some of these things we're dealing with now around social anxiety, particularly students who are and people who kind of bonded socially,
Yes.
and then now they don't have that. And it's something I hear all the time. I hear about one child doing well through the virtual platform, another child who's more sociable not doing well in the virtual platform. This also happens to adults. So
Yes.
that's out there, and that loneliness and despair is out there. And then that causes sometimes that they call it the pandemic fatigue or the COVID fatigue. So because you're so fatigued, you may go do something you shouldn't do. And then someone gets sick. So that's part of that fatigue. We know it's just the mental health of it all, needing to be around people.
What if a child feels bullied? Is there someone they could go to?
They should always go to the first adult they see and around them.
Okay.
So if it's a teacher, go to that teacher. If it's someone walking in the hall, well, not walking in the hall, if someone on the virtual world that they're there as an adult, paraprofessional, go to that person. I would like to say, go to the principal, go to that individual right then and there. We've been trained on how to handle it. Go to that person. They can get to an adult. They can get to one of the principals or guidance counselors who can help you. Go to that first adult you see and tell them this is what's going on right now.
Okay, thank you. By the way, with professional development, does that include best practices for virtual learning?
So yes, and our Dr. Morgan did a wonderful job this September. We had 4 days. We moved most of our PD days up, so we had 4 full days of virtual PD.
Okay.
Because our teachers, quite frankly, were thrown into this whole environment last minute.
Yes.
And so what we learned over the summertime with talking with parents and families is that we need to do a professional development for our teachers. We need to do a professional development for also the central office administrators, including myself, around instruction when it comes to the virtual world. And so we did that, and we did that moving forward. Now we're also planning, when we're able to come back in hybrid, to do a PD for teachers using the model they have in Milburn, the model they have in Livingston, and the model they have in Princeton. And we did a video of that we put on our website, I think 2 weeks ago.
Okay, that's helpful. Now, the children were to return to school November 16th, correct?
Yes, ma'am.
When did you present your reopening plan to the Board of Ed?
We did that back in the summertime.
Okay.
And then we had to make adjustments as we went through this. And so what I would use is our update. We had a weekly update we would use, and we would just put them out there. I think we've had over 16 of them. We put them out there, what's happening and what changes are, because we had to change some things in motion with information that came in. We would constantly put them out there, changes in what we're doing. We wanted to make sure people had enough information. And what we also do is we get emails about questions. We get those questions and then form our next statement out based on answering those questions. So we've been doing it for a long, long time, and we're going to continue to do it. And we're going to, even when we get kids in, we're going to continue to do it. We think it's a nice way of communicating to our families weekly about what we can do. They won't be as long as they have been in the summertime because the information won't be as much.
Yes.
But we continue to do that. We want to continue to do that.
Okay. Now, are those documents available to the public?
Our return back document is on our website and available to the public. And although updates are all archived and are able to also be pulled up on our website and read.
Okay. And you did just explain how parents and caregivers are notified of any of the changes and so forth.
Yes.
Does the staff have the opportunity to have conversations with either you or your teams?
I'm hard to get sometimes. I do meet with them, but I'm a very hard to person because everyone's asking for my time. But they do have access to their building principals. They have access to administration. I do believe teams now are working on some questions that some staff members have. Our central office team also has some questions staff members have, and we answer them and send them back to our association.
Yeah.
And so absolutely. In fact, we were meeting with some principals today and they were asking us questions some of their staff members had that they couldn't answer. We were helping them answer those questions.
Okay, are they able to help participate as a team member to brainstorm some ideas for problem solving?
Right now, yes. In the buildings, yes. What's interesting is that many times you want to solve a problem, we have to get things vetted through our doctor's office and
Yes.
also our medical team. So sometimes we have to say that's a good idea, but we have to take this to our medical team and to our doctor's office to get an answer because they have to actually give us the final clearance. A great example is when people want to do, I'll give an example, picture day or something like this, or a club. Can we have a club and do these things? We say, write it up for us, give it to us. We'll give it to our medical team and our doctor. They'll vet it, and then they'll either approve it or not approve it or make changes to it.
I see. Okay, thank you. Now, what about the status of the ventilation and the wiring and lighting systems in each building?
Now that's the $1 million question. So
Okay,
ventilation is mechanical ventilation. We've had over 150 repairs to our mechanical ventilation pieces. So these are the ventilation pieces that we came in July, we found out through doing our assessment with our engineers and our architect firm, they weren't working. They weren't working properly. They weren't working properly. And many weren't working at all. So we had to make repairs to them, all of them, about 150 repairs overall. Also our damper systems. So I've learned too much about dampers where you have to, it's how you will allow fresh air into your system. So we had to make repairs to our damper systems, and I had to learn between electrical damper systems and also compression air damper systems. So just last week, Northeast and Edgemont's compression air systems were fixed. And so they could actually allow air to go through it at a good rate, and how we have to increase those air quality, the air, outside air intake. Now we have some older buildings. Some of our buildings are older and do not have mechanical ventilation pieces to it. So we had to get a plan. I went to our EI, our engineering firms, and I said, please give us a short-term plan, a mid-term plan, a long-term plan. So our short-term plan were places without ventilation, where appropriate, open up, create natural ventilation, open up windows and put in an air purifier, an industrial air purifier to purify the air. Now, if it gets too cold, that's a different story. I have to make those judgment calls as the administrator if it's adequate enough outside for us to be able to have windows open. If it's freezing outside below degrees, that's going to be very difficult. But that's our midterm plan design, or our short-term plan designed by our engineering firm that really helped us with this. And they explain it as sort of like a car AC. You get the air in, the air purifier cleanses it and goes through. They said what also helps with that natural ventilation is that you have a smaller class size. So do not have 20 kids in a classroom. You're looking at between 7 and 8 kids in the classroom, even less than that in some cases. One staff member, maybe sometimes 2 staff members in a room. We have to really look about how many people are in the room actually. PPE equipment, do you have the proper equipment on? Mask wearing, staying 6 foot distancing. All those pieces mitigate with all those pieces mitigate the virus, contracting the virus. So it's very important to meet all those pieces. Also, when it comes to our ventilation systems, we are really having to make sure that our systems are working consistently. So when we fix something, we have to make sure it continues to work. Yeah. It continues to be effective. So we have plans for that, having extra materials if something goes down to be able to fix it quickly. It's been interesting. We've learned a lot about HVACs and ventilation in the past few months, and we feel good about our plan. Working with our engineers, our mid-term plan is to have an ionization system that helps our ventilation system, and then long-term plan is to have mechanical ventilation in every building, in every part of every building. So it's been interesting. I've learned a lot about something I didn't have a clue about before I walked in July, and we've had to learn a lot about that in the past several months, and still making sure we can do the right thing. The biggest thing is that we don't want to put anyone in a situation that's not safe,
Right.
and so that's our biggest thing. And so we're making sure we're following guidelines to mitigate the virus. And when it comes to increasing natural airflow or getting airflow in, that's our biggest piece. And then when we don't have mechanical ventilation, making sure we have an air purifier there to help us with the natural ventilation.
Now you mentioned mid-year. What is mid-year?
No, I'm saying mid plan. Our mid plan. Our mid
Okay.
plan is ionization. I shouldn't have said mid-year, but our mid plan is ionization. Having ionization in part of our ventilation pieces.
And the timeline for that is?
Mid-year, our mid plan will end up in the end of this year. So the ionization pieces will end up happening and being finished by the summertime. Our short-term plan is now. We feel like we executed it now.
Okay. And when will students return? What, do you have a projection for that at this point?
December 1st, we'll be reevaluating it. Speaking to peers out there, I know some of my peers have made a decision. We're going to reevaluate it, look at the infection rate, look at the rates of where it's due, look at the trend lines of those rates, and then make a decision on that.
And is there a particular metric that you would be using?
Absolutely, the infection rate and case rate.
Okay. For what areas? For the town, for the state?
For our region.
Okay.
Because people work out, our town is one thing, but people also leave our town and come back in. And really looking at those rates and looking to see how those rates are going down or going up.
Okay, well, thank you. We, as you know, I had requested questions from the public early on, and you had the opportunity to review them and comment as they were given to you. We do have a couple of minutes, and we do have a couple of questions from the chat room. Are you open to answering perhaps a couple of those?
Sure.
Okay. Now, again, we're working with the pandemic platform. Is there a provision for people with subject matter expertise, but without a teaching license, to teach specialized courses, particularly in the sciences or mathematics?
We're required by the state of New Jersey to make sure anyone who teaches students has a teacher's license. It's a requirement, and it's to make sure we can retain quality out there. And so it's a requirement, and we have to give a report of all of our teaching staff certifications once a year. And so we have to do that. But you can probably help us with tutoring, maybe helping us in some other places, like in Monty or other places like that.
Okay. Another question. Since we have a high rate of Black males classified with an IEP in the district, what are you going to do about the fact that the child study team does not have any African-American male staff members? Is that a fact?
Well, I don't know the exact numbers in the child study team, but I can tell you we are working, and we have done it this summer, actually, diversifying our staff members, and making sure we have a diverse staff member group that look like our students, and making sure they're high quality. What I can also tell you is we've been looking into why students, particularly African-American males, have been classified more. And we're digging into some of that data and information. And one of the things that's coming up is are we being culturally responsive to our students? And that's something that's coming up. And also, are we making sure every child can read? So we're really digging into that information, why this is happening. But one of our initiatives is hiring a diversified staff and keeping one. So we are really looking into that. And we're digging into those deeply and finding the root causes to them. And one of the things that keeps popping up over and over again is, are we being responsive first and foremost? And two, are we making sure every child can read? And getting a child the resources to be able to read in making sure they don't get classified because of that.
Mhm. Okay, thank you. Let's see. Going through some of the questions. Don't want to ask what has already been asked. Um, let's see. I'm just doing a quick review of them. Um, Going back to tutoring, how if somebody has expertise in the math or sciences and they were interested in doing some tutoring to help students, how would they do that? Who would they go to?
They'll have to, you can email me, but I get a lot of emails, but Dr. Morgan is a good person to email. She's our assistant superintendent of curriculum and instruction. If it's math and science, also Ms. Goforth, who's our math and science supervisor, is another good person. But Dr. Morgan and myself have connections to our tutoring agencies out there, our tutoring programs out there. We can reach them out, we can connect with. So if you can try to get it to Dr. Morgan, get it to Ms. Jen Goforth, and also get it to Mr. Vargas. We can move you quickly to someone who can help you get involved in tutoring.
Okay, that's good. Thank you. So those people who have that question can seek answers that way, and perhaps they would definitely be able to help, because that seems to be a need, to make sure that the children are staying on top of their learning activities. Speaking about learning activities, with virtual and hybrid instruction training, is that an ongoing process that's taking place?
It should be a part of our process taking place. I know we had this training in September, but we also have those Thursdays, I think they call them curriculum Thursdays, or those training Thursdays that should be taking place. Best practice, people talking to each other about what's going on and what we can do. And that happens, central office helps it happens, but it happens in each building. And so please, if there's someone out there who needs help or needs to see something, please tell us. We can actually get to it and help that environment, that school or that individual.
So it's done virtually, correct?
Yes, yes, everything is done virtually right now.
So what would virtual and hybrid instruction training look like?
So a hybrid instruction training, we sent a video out there, and we want to bring people in to do a hybrid instruction training, but right now, because of the infection rate, we pulled back that training. We didn't feel it was good to bring people in to do that training. They would be in their classrooms by themselves, but we felt that, hey, it's not what we need to do right now. But they did the virtual training virtually.
Yes.
And they logged on to these items that say, hey, this is how you do seesaw, or this is how you do these things, and they learned it virtually. But our hybrid, we want to bring people in. We pulled back on that based on the infection rate and the case rate and so on.
I see. Okay, someone wanted to know why recent professional development days were used for self-directed professional development training rather than a hybrid. Is that an accurate question?
I'm not sure of where. If they could tell me the school, I could ask the administrator and also ask the assistant superintendent that question. But my understanding is that we have a Thursdays, there's plan and there's things to do. Now, I would love to find out where, and I'll follow up with our assistant superintendent, and also follow with our administrators there.
Okay, because the question is stated, can you explain why the recent professional development days were used only for self-directed professional development rather than virtual and hybrid instruction training?
Well, I can't explain that, but if that person would like to email me, I could email them the answer after I speak with the assistant superintendent about what happened with those days.
Okay. All right. Well, thank you. And of course, if anyone has questions, they can certainly email you, correct? Or any of your team members?
I would say, please, just know that we get a lot of emails during the day, and that be patient with us. We'll get back to you, but it can take some time.
Okay. Thank you very much. Ms. Ward, I want to see if she comes on. Yes. Ms. Ward, you have been our chat room monitor. Are there any questions that you see that we have not addressed that should be? I'm scanning quickly. Thank you again, Dr. Pons, for your patience. We truly appreciate this and the fact that you're giving your time. We really do appreciate this.
There seems to be some need for more clarification around the criteria for opening or not opening schools with COVID, about rates. Exactly what are the metrics going to be used on schools being reopened or not?
Again, it's the case rate. So how many cases, I think it's per 100,000 over a 7-day span, and then the infection rate, how the spread is happening. I know if you look at New York City, they made a decision to close because their infection rate was at a certain point. So we do those same things.
So is there a certain rate, like 3%, or is there an actual rate upon which?
Well, you have a standard where they say high,
you know,
and they say, you have a standard where it says high. And for a fact, our infection rate right now is at, I think it's over 8%, which is up 2 or 3% before. And then our case rate went up from 16% to 24%, which is considered high. So we look at those things and we make those measurements. And what you also see is a trend of it going up. So when the trend's going up, it's not a good sign. You want to see a trend going down. So for instance, in the summertime, our infection rate was low and our case rate was like 2.61. So you got to look at those things and measure them out.
There also seems to be a lot of concerns about the quality of the virtual learning experience to date, and repeated questions about what exactly is the training being offered to teachers for virtual teaching.
Well, I know what we're experiencing is our younger children aren't getting the same qualities they would have gotten in the classroom. One of the pieces is the social piece, quite frankly, and I think I talked about that earlier, that this doesn't happen in a virtual world as it should. But absolutely, nothing's going to replace a teacher in a classroom, and that's just the unfortunate reality. But I always go back to we're in a pandemic, and you know, one of the things I'll just say is when you speak with someone who's impacted by the virus, and you hear what they're going through, it can sober you, it can sober your thinking, it can sober how you respond to things. So when you make tough decisions, you got to think about all these pieces. But you want to make sure that people are getting the help they need, and when. And I feel that we need to do a better job with our childhood kids, getting them some more time in buildings. But right now, we're just at that point where I feel the infection case rate where it needs to be.
Okay. And then just one other thing about a question. Would you be open to creating an outdoor learning plan for students in the springtime?
You know, that's a great question. And I think I spoke with some of these individuals about this before. We're regulated by the Department of Education. So classroom sizes, all those things, even the size of the bathrooms and those things are regulated by the Department of Education. When you have an outside classroom that you're not using for a classroom completely, that's different regulations than you do when you're having a classroom outside the whole time. So we have to get those regulations past the Department of Education before we can actually have those kind of things take place.
Okay. Thank you. I think that's most of the questions.
I'm going to throw another one out to Dr. Pons. With your hiring practices, are there specific qualities that you're looking for teachers for Montclair?
The first one is that you believe all kids can learn,
Mhm.
and you believe all kids are special. Those are two of the things that matter the most. And then we want to find someone who's committed for being here for a long term. Most new teachers leave between year 3 and year 5 of their career. And we want to make sure that someone's committed to us and that we're giving them the proper training. But Those are the two biggest pieces. Do you believe all kids can learn? And do you believe all kids are special? If you don't have those two pieces, then it's a no starter for me.
Okay, thank you. Did you have any comments that you would like to make to possibly summarize? I know you had mentioned that you talk to others, do a little collaborating with others in other districts as well. Is this an ongoing thing, and how does that influence your decision making?
Has a lot of influence on my decision making, and I actually have a meeting on Friday, and we meet a lot. We call a lot. We text each other a lot, and we talk to each other a lot about a lot of things, about things that are going well, things that we're trying to make a decision on, and we vet and see each other. So it's something that superintendents do an awful lot, and I do an awful lot, and I've always have, and will continue. But absolutely, we're always in conversation. We're always in meetings. We're always discussing things with each other via phone, text messages, or even just hopping on a Zoom.
Okay, thank you. Well, again, we'd like to thank you for your time. Ms. Ward, was there anything else that you might see that I missed? Because Dr. Ponce has addressed.
Right. Other than, ongoing, the bulk of the comments seem to be around this issue of obviously wanting kids to get back in school just as quickly as possible. And I think Dr. Pons has talked about that a couple of times tonight.
Yes. And it's, are you doing any surveys with parents or staff?
Surveys around
Virtual learning, just help you set goals for what you want to see happen?
I believe our student representative talked about this in our last board meeting. She'll be doing surveys with students.
Okay.
And Dr. Morgan's discussed doing surveys with staff also around these pieces. But at this point, we have not.
Okay. Now, what specifically, when you say they will do some surveys?
Oh, I'm going to talk to Dr. Morgan about what she wants to look for in surveys. Me personally, what I'm looking for is how's it going and how can we make things better for you? So like a Lightner scale of 1 to 5 or 1 out of 10, how's it going to? What are some of the best practices we can do things for you? We can do for you to enhance the education for your students.
Yes. Okay. Sounds good. Well, thank you again.
Thank you.
Ms. Ward, was there anything else that you see that
No, I think it's just that the same topics. A good suggestion about, including in the survey, how is the virtual learning, asking parents how virtual learning is going so far, which is a good suggestion. Yeah, I think that's it.
Okay, thank you so much. Well, Dr. Pons, again, we want to thank you so much for your generosity this evening. We truly appreciate your time. I'd like to thank our Zoom host, Donna Ward, and to Lois Donegan, Board Director, Community Chair, for helping with the questions. Certainly a thank you goes out to the NAACP, our community partner, and to you, the audience, for your attendance and questions. With that, I'd like to say good night to Dr. Pons and one more thank you, and ask everyone to take care.
She says, everyone please stay safe.
Yes, thank you again. Ms. Ward, do you have a few minutes to stay on?
I do.
And I